Indonesian hospitals totally across the country have 389,000 beds. So before the Lebaran holiday, we anticipate already that there will be a significant increase to the incoming patients. Before Lebaran, we have 23,000 people in isolation bed because of COVID. We are already preparing to increase our bed to 85,000 beds. So we have rooms almost 3 times the existing COVID-19 patients. In the last 3 weeks, we saw a significant increase from 23,000 patients to 72,000 patients as yesterday. So we still have capacity, 85,000 beds, and we already increased in the last 2 weeks to 92,000 beds. And as I mentioned to you before, we have 389,000 beds across the country, and we have issued a policy, 30% of those beds, which is around 130,000, will be dedicated for COVID. So we still have room from existing 72,000 patients to 132,000 beds for COVID, out of 389,000 beds across the country. We have 2 issues. The first issue is the acceleration is much faster than what we saw in January, February. That's why for a very dense area, risk area, we start the mobility restrictions next week to make sure to reduce the speed of incoming patients to the hospital. Second, we identify also it is not well spread. Like I give you an example, in Jakarta area, it's already reaching 90% of the bed capacity, whereas in Sumatra and Kalimantan, it's only 30% or 40% bed capacity. So we also realize it's not evenly distributed. So we go up into a regency level to make sure the supply and demand of beds, healthcare workers, medicine, and also oxygen level at that level, not at the national level, nor even at the provincial level. We have to go to a regency level to see the balance.
Sir, as you mentioned, the importance of oxygen, which we know is critical when it comes to combating the severe cases. Also, we're hearing reports about oxygen prices surging and some suppliers citing shortages. Can you give us what you know about this situation and what the government can do to help this problem?
Yes, after we learned from our neighbors what happened there, and we mapped the oxygen conditions in this country in May before the surge happened. For your information, overall capacity of Indonesia in producing oxygen is 866,000 tons per annum. Out of those full capacity, all the factory that we have only produce 75% of those capacity, which is around 660,000 tons per annum. So on supply basis, we have room to increase our capacity by another 20%, 25%, or around 220,000 tons per annum. Of this 660,000 tons per annum, 75% used by industry, like steel industry, nickel industry, copper smelter. So 75% is used by industry, and only 25% or around 180,000 tons per annum, compared with our full capacity, 860,000 tons per annum used for medical oxygen. So we still have capacity, and we have talked with all the industry that we will reduce the allocation for industry for the time being and allocate back to the hospitals. And again, for your information, the industry absorbed 3 times bigger than the existing hospital capacity. So even if we increase the demand for the hospital side, we can still absorb by reducing the allocation for the industry. We still can absorb by increasing the capacity of the factory, because they are now still running at 75% capacity. We do have an issue though. We do have an issue. Again, it is not well spread because the factory mostly located in West Java, East Java, not in Central Java. That is where the location we see the lack of oxygen because of distribution issue rather than supply issues.